Assalamu alaikum everyone. Welcome to the class of healthcare management. Today we'll be doing marketing responsibilities of healthcare management. So the learning objectives of this presentation is discuss the reason for modification of traditional 4 Ps of marketing in healthcare, compare the characteristics and purposes of inbound and outbound marketing, distinguish among advertising, publicity, promotion, and public relations, compare traditional and social marketing strategies, compare the cost and effectiveness of branding and other marketing tools, discuss the need to consult with marketing professionals. According to American Marketing Association, marketing is the activity or set of institutions and processes for creating, communicating, delivering, and exchanging offerings that have value for customer, clients, partners, and societies at large. So it is about delivering and creating demand for objects or facilities that are of value for the customers. Many marketing professionals have modified or abandoned traditional marketing approaches for healthcare because of uniqueness of its business. For example, a classic approach to marketing is control of the 4 Ps of marketing: product, price, place, and promotion, which may be applied in healthcare as follows. Product, the goods, services, and ideas offered by an organization. A lasting, loyal relationship is often considered the product of a healthcare for marketing purposes. So, as such, the healthcare manager or the practitioner is not offering any product but his her services. So, if in regard to the services, there's a good loyal relationship, and the customer comes to you again and again, it is regarded as a good product. Price, the charge for the product, including professional fees, insurance premiums, and co-payments. Effort costs are often included in healthcare marketing. In addition to money, patients and clients must relate costs to long-term benefits of care, including lifestyle changes that demand a great deal of effort on their part. So, healthcare practitioners take price or fees of their services that require a lot of time demand and effort demand on the part of the practitioner. Next comes the place, the manner in which goods and services are distributed to consumer. Place often enhances the perception of quality in healthcare. Place includes communications that are not face to face, such as online information, and the ability to share medical records electronically. So this place could be where your clinic is available. This place could be a website or a Facebook page through which you are providing your consultation. Promotions, any means to use to inform a market that an answer to its needs is available to facilitate an exchange. It is often a mix of advertising, direct sales, sales promotion, and publicity. So promotion is actually the marketing where you let the people know where your product is available, what your product is, what place it is available, and what it is going to cost the customer. The application of the 4 Ps to healthcare has not been easily accomplished. Customer satisfaction became patient satisfaction, and new ways to measure satisfaction have been developed. So, a theme that has been used from business administration has been converted, and the wordings have been changed according to the healthcare settings. Unlike other customers, though, patients are rarely the ultimate decision makers about buying healthcare services. They rarely select what they are buying, and they usually don't have a choice when they need a service. Patients do not know the price of a healthcare service, so they do not base selecting a service on price even when they have a choice. So their choice is usually dependent upon the advice of the physician or the doctor or the nutritionist and reviews that he gets from other doctors rather than based on price. Patients require the referral of professionals to services that they often know little about, making it difficult for them to judge the quality of those services. Just consider the difference in buying processes when a person needs a new television and when a person needs a total joint orthoplasty, for example. And in nutrition, an example would be uh, whether a person selects an oral route or an intravenous route or a parenteral nutrition route of administering nutrients to the body is not dependent upon the choice of the patient rather than upon his physiological disease, his needs, and directions given by the nutritionist. So there are two types of uh, marketing. For the purpose of this chapter, marketing is a managerial process. Now, this is defining again in this chapter how the authors of this chapter have defined it. Marketing is a managerial process that includes a wide range of activities to assure that an organization meets its goals by meeting the needs of its customers. In one model, marketing is viewed as processes that are both inbound to the organization and outbound from the organization. Inbound marketing includes marketing research to identify potential customers, their needs, the means to meet those needs, analysis of the competition, and positioning and pricing a new service, finding a niche. Niche is something that is new. So, in inbound marketing is more of like a research where you plan ahead how you're going to promote your product. In outbound marketing is the actual promotion of a product or service through advertisement, public relations, and sales strategies. Success depends on attention to both inbound and outbound marketing processes. Until recently, healthcare focused primarily on outbound marketing, typically without much attention or analysis of its effects. Physicians were often the only focus of hospital marketing efforts. Today, healthcare systems often have vice presidents of marketing or marketing consultants who guide plan that managers implement at the all levels of an organization. Even solo practitioners must assume responsibility for marketing to reach the goals of their small organizations. So initially, what was done that marketing was done. Let's say Abbott has to sell its products. What it would do, it would provide uh, maybe trips, maybe discounts at some places to the doctors so that uh, they would write down their medicines or their products. But now there are separate departments of marketing and separate professional people are hired to market the products. Now coming to inbound marketing, in large organizations, mid-level managers who are developing new programs, they work in collaboration with marketing professionals who are accountable for a broader systematic marketing plan. Inbound marketing, that is research-based more, is achieved through various processes. First is target markets. The first inbound marketing responsibility is to identify the potential group of patients or clients with specific needs to be met, or to survey a broad group of people in the community to identify opportunities for new programs that may need development. This development is particularly important in healthcare, in which increasing the patient base is very important to increase the revenue and profits when costs and reimbursements are so tightly controlled. So, as the cost increases and there are fewer reimbursements through, I don't remember the word right now, but that is why it is important to improve the patient base, the number of patients that are coming to you, and to increase the revenue. Managers identify target markets that can be described by age, sex, income, educational levels, professional, career, type of residence. Technology for data collection and analysis has made these processes easier. So it needs to be identified who are the people who are going to want our product. Let's say if we talk about milk, children are the ideal ones to be targeted to increase the sales of your milk products. Let's say if you're talking about maybe micronutrients, pregnant women are the ones who are in the highest need of the micronutrients. So pregnant women can be targeted to uh, improve sales in of the micronutrients. Marketing success is depending on knowing customers' likes, dislikes, goals, and expectations. In other words, answering the question, what will satisfy these particular specific customers? So you research into deeply into your customers, the target customers that you have decided. You research deeply into the likes, dislikes, and opinions of these customers. In addition to databases, more direct collection techniques include having employees report what patients and other customers ask for or complain about, directly asking them in person about their needs, focus groups, or having patients submit comment cards or complete electronic or paper surveys. So, paper surveys, satisfaction cards, and actually receiving comments from the customers can improve and can provide insight into what they want. After identifying the target markets and the target people, patients, product demand and clarification needs to be established. Do these customers want this, and how you can appeal to them? Because of this inbound process, managers should be able to describe clearly the product or service from the perspective of the target market group, emphasizing special features that have been designed to anticipate their particular needs, build satisfaction and loyalty. Determining how a product or service is packaged and priced is the next step. So, if a new product is being launched, highlighting its special features would build loyalty and demand would increase. And packaging and pricing also determines the demand of the product. Finally, the demand of a product or service in healthcare needs to be identified as specifically as possible. It should meet some particular needs, otherwise, it will be very difficult to improve the sale. Managers and entrepreneurs become spies in gathering some of this information, yet cannot be shy about asking questions of any potential source of information while determining how important is to keep these inquiries confidential. Networking at professional meetings and other business gatherings is a way of discovering potential sources of information. Talking to people who have received services in the competition's practices may reveal additional factors important to potential target markets. Being open and honest about plans for a new business may cause others to put up a defense, making it harder to get information. The next point that we need to do today is about competition. Managers also need to directly their attention towards competition. Competition means that if is this your product new and unique, then maybe there is no competition. But usually this is not the case in healthcare. Managers need to determine their attitudes about competition at the first step. Do they competitively want to follow their competitors, or do they want and focus on their own business, or do they want to ignore everything and just focus on their work? In any case, managers need to establish the uniqueness of their product and identify a name, a brand, to reflect that image to set them apart from competition. A name or a brand or a statement who could help them set them apart from other people. The starting point of this process is competitor analysis. First, you did the analysis of the target population, then you uh, thought how you're going to make your product unique. Now you are going to analyze who the competitor is, what they are providing. This helps to determine the advantages that organization has over another. It helps in forecasting returns on possible future investments in the organization. One way to analyze the competition is for managers to ask some key questions. Who are all of the competitors for meeting specific customer needs or preferences? Now there is a list of questions that need to be asked. What is the competition's profile, location, vision, mission, and goals? Organizational structure, market segments served, capacity, number, and types of employee. So a detailed profile of the competition's company. This will let you know where there are loopholes and how you could improve your work. What strategies do they use to meet their objectives? How do competitors, products, and services differ from one another and your organization? What are the strengths and weaknesses, threats of the competitors? How satisfied are the competition's customers? Who are the competition's partners and supporters? What are possible actions to beat the competition? Can they be done? How will competition react to the projected changes if they are made? Who are potential new competitors? So, an analysis of these is going to help you improve your product and think of some way that you could enhance the sales of your product. Have you ever seen the case of different milk products? They usually target each other in their ads just to show that they are better in milk ads, in dishwashing ads, in washing powders ads. So and even in the tea ads, I've seen that they are targeting at each other and showing the importance that how their work is better. Gathering data to answer these questions requires putting together information from a variety of sources, such as published reports, brochures, asking suppliers, customers, and former employees. Simple, disciplined, direct observation of advertising, press releases, trade show presentations, and other social contracts also provides information. Tracking changes in the competition's advertising may reveal new directions, products, and services, or a change in the focus of their strategies. So, this might give you an idea how they are working and how you could improve your work. Next, after uh, competition, is benchmarking is the tool for comparing competition. Using ideal standards for best practices, organizations are compared across a variety of key success factors. So there are different benchmarks available, and you can compare the companies and their advertisements and their products across it and see which are the better. Managers may use benchmarks to identify necessary initiatives to improve their competition position. The challenge is the accurate analysis of the data and then developing a plan to meet or exceed the competition. This may mean doing the same things over better or developing an entirely different approach. So, till now, we were all doing research work, we were all doing analysis and critical thinking. So, how could we improve our promotion and how could we improve our product? How could we reach the best target audience and improve our sales and products? The last aspect of uh, inbound marketing is the SWOT strategy. SWOT is another classic marketing analysis. SWOT identifies the strengths and weakness of an organization, internal factors such as resources and capabilities, and the possible opportunities and threats, external factors such as competitions, reimbursement, and government policies. SWOT is generated through an environmental scan, which is systematic surveillance of the internal and external events and conditions that affect the organization. Outbound marketing is the next. Outbound marketing Outbound marketing has shifted somewhat from image advertising to specific targeted promotions that include more informational content for specific products and services. Advertising and Advertising and promotions are supplemented with sales and public or media relations that focus on an organization as a whole. They are complemented by customer service and satisfaction efforts. If inbound marketing efforts have been effective, outbound marketing should easily fall into place. If you have a good research who the competitors are, if you have done the SWOT analysis and you have analyzed and benchmarked your competitors, it the outbound marketing, that with advertisements and promotions and public relations, it would definitely improve. If inbound marketing is skipped or ineffective, no amount of outbound marketing may lead to the desired level of use of a product or service. The standard practice of developing a product or service and then convincing people they want it seems to be over. So, the product needs to be such that it is in demand from the clients rather than making a product and then creating a demand of it. The first aspect of outbound marketing is branding. Healthcare faces the challenge of marketing intangible concepts such as quality, caring, and professionalism to develop a perception of an organization. This requires establishing a mindset of the image of the organization and its services. So, most of the services that healthcare managers and the practitioners provide are intangible, cannot be measured. Healthcare services are often difficult to quantify and evaluate because they are personal, subjective experiences that are not open to the same types of quality controls as are tangible products. They reflect the persons who are providing them and really cannot be owned or transferred. The solution to this dilemma is a brand, some name, symbol, or some other feature that distinguishes an organization from similar organization or services. Selecting other outbound marketing tools. Managers have to decide the comparative value of efforts expended, funds available, and costs associated with a wide range of outbound marketing possibilities. So, you have to select and decide from the range available. Particular attention must be given to which target markets to appeal to and what message has to be communicated. The most preferred and effective means for delivering the message is balanced against what is affordable and practical. Some selected tools are given following. So, all of them or a few of them can be selected based on the needs of the healthcare professional. Sponsorship of sports teams, charities, and arts. Membership in professional associations and community and civic organizations. Community outreach, such as participation in health fairs and other educational programs. making camps and providing free services can go a great deal in marketing your product and yourself. Logos on stationery supplies, apparel, and signage, publication of newsletters and brochures, hard copy advertisements in newspapers, community directories, radio and television ads of public services. The measurement of the consumer response to these tools is limited, so it is difficult to determine their effectiveness in meeting an organization's goals. Because usually, the customers who receive these advertisements do not reach back to the practitioner again, so it is difficult to see its individual efficacy of all the points that have been discussed above. A shift to more consumer-driven tools such as interactive websites with web pages that include message boards and links for clients and potential clients to use to request more information, blogs, social networks, and word of mouth referrals are often more cost effective, and the rate of usage and consumer responsible are more measurable and more quickly available. The use of social media, use of website is more helpful in marketing. Marketing physicians and others. Yani it means use of physicians to market yourself and your products. Physician and other health professionals who may refer patients remain a target market of particular concern to all independent practitioners as well as to large healthcare systems. Not only must managers establish referral relationships and identify and meet the needs of the people who refer, but they must also be able to sustain a consistent commitment from the physicians and others for referral. So there is a need to establish good cordial relationships with other counselors, employers, and attorneys to increase referrals in especially in the initial years of the practice. Later on, word of mouth and your quality of work performance is going to act as your marketing help. The third aspect that now is usually used is social marketing. The discussion so far has been focused on commercial marketing to bring about voluntary exchanges that result in an organization meeting its goals and patients meeting their needs. Social marketing is the application of commercial marketing techniques to services that are designed to influence the voluntary behavior of target groups to improve their personal welfare and that of society. This is use of social techniques. Examples include smoking cessation, safe sex practices, breast cancer screening, family planning, and seatbelt use programs. The key concepts in social marketing include the following: a patient customer centered orientation, accounting for real and perceived barriers that prevent people from adopting a new behavior, demonstrating the benefits of the desired change for people in the target markets, using a variety of means to reach target markets, presenting and monitoring marketing interventions as they are implemented, forming partnerships that enhance credibility and facilitate access to target markets, coordinating with other approaches to social change. What is the summary of all these points? That the healthcare manager is not just aimed at improving the sales and just improving their revenues. The aim of the healthcare manager is to improve the social sense of the people so that they are responsible to improve their own health. Managers must distinguish between traditional marketing efforts directing at meeting the needs of customers and social marketing efforts directed at changing the behaviors of a group of people. So the net effect of the social marketing is not to improve the sales or revenue, but to improve the health of the community. It is like community service. Social marketing shifts the emphasis of marketing from what is good for the organization to what is good for the broader society. And what are the managerial responsibilities in improving the marketing of their organization or their practice? Managers in healthcare organizations and private practitioners typically rely on marketing experts to assist their decision making. Efforts to increase efficiency and focus on outcomes of quality care may require organizations to focus on different set of marketing tools. To meet these needs, they may outsource their marketing function to a full service marketing firm that plans and monitors and executes all the marketing uh, functions. Larger organizations may have in house marketing staff who coordinate with a contracted agency for marketing, such as direct mail campaigns or media purchases. Smaller organizations may rely on a marketing agency intermittently as needs arise. For example, graphic art for a logo or a website building. In any case, familiarity and comfort with the unique features of healthcare organizations are important factors in the selection of a marketing professional partner. Even the best efforts at inbound and outbound marketing may fail. These things need to be considered. It is not taught that every time you're going to succeed. Managers need to be comfortable that they made the best effort to arrive at the best decision, particularly as it relates to the needs of the people who are often in crisis when they require healthcare services. Managers also need to consider the ethical implications of both commercial and social marketing plans, considering whether actions are persuasive or coercive, for example, how the organization addresses these issues so that the target markets are respected and treated fairly is somewhat enhanced by the shift from straight advertising to promotions that emphasize education. So all these factors need to be considered. Ethical dilemmas need to be considered that only increasing the sales is not should not be the aim of the healthcare organization rather than educating their clients to improve their own health should be the aim, and the it should not be coercive, and it should be for the best benefit of the people. Evaluating the effectiveness of marketing efforts is another challenge because direct relationships between efforts and results may not be obvious or even measurable. For instance, increased profit margins, satisfaction of staff and patients, and increased demand for services or the number of new patients may or may not be associated with advertising or public relations. It may indicate that inbound processes were effective or ineffective. Managers must be contribute to both establishing and evaluating marketing efforts. So it is very difficult to evaluate the marketing, and mostly it is not done, but evaluating the marketing process is important so that any uh, mishaps or losses should be incurred. So over here, our chapter comes to an end, and I would like that in the next class that we discuss different marketing strategies and how healthcare products and different companies, nutrition companies like Abbott and Nestle, have branded themselves, what logo they used, what taglines they used, and what are their strategies to improve their products and to improve their marketing. So I'm logging off here.